Welcome, everyone, to another episode of My Generation, a podcast sponsored by South Shore Senior News. I am Steve Dubin, your host, and today we have an interesting guest with us. Danielle Delince is the administrator for the Hellenic Nursing and Rehabilitation Center in Canton and has had an interesting career from journalism to healthcare. And Danielle, let me bring you on and maybe you can tell us a little bit about your background.
Well, hello. As you mentioned, my name is Danielle Delince. I'm the executive director at the Hellenic. We are a Greek-based nursing home in Canton, Massachusetts. We have about 154 beds at the facility and a Greek population of about 18 to 20 residents at any point in time.
Okay. And a little bit about your background, things you've done before that sort of brought you here today.
So I was trained as a journalist. As I mentioned to you earlier, offline. I went to Northeastern, I graduated from Northeastern University with a degree in journalism and a concentration in print journalism. So I worked in print at the New York Times, the Boston Globe. I worked in television, NBC, CBS, and CNN.
Okay.
Before I became a nurse. I became a nurse in 2008. And then since then, I've been in healthcare, both as a nurse and a nursing home administrator.
Great. And what brought you to healthcare and in particular, helping seniors?
Well, the newspaper industry went through a major reorganization with the advent of the internet. So I had to reinvent myself because I had gotten laid off a few times in the newspaper business. And I finally said, I'm getting into a more secure industry, which is why I switched in 2006. I went back to nursing school, had to reinvent myself, and then became a nursing home administrator in 2014. And I've been working in that industry ever since. And I enjoy it thoroughly because I enjoy the relationships that I'm able to build. I enjoy caring for others, caring for patients and residents, and really interacting with the families. And that's the part I enjoy the most. Being able to resolve issues for them when they have a concern about the care of the residents. I try to build a really great relationship with the families and in the community as a whole.
Okay. So let's talk a little bit about, I think, a lot of folks who haven't had a relative in a nursing and rehabilitation center don't really understand what happens there. And sometimes they have a erroneously negative thought process of what goes on there. Tell us a little bit about sort of your general operations and the kinds of services that you offer, both long and short-term rehabilitation.
Okay, that's a great question. So typically the patients come from the hospitals, which are our main partners. So the residents will come in after they had a stroke, a decline. It could be a number of diagnoses that require rehabilitation. So they'll come to us needing short-term rehab. So our therapy department would work closely with them to assist them in walking again, being able to put a dress on, going to the bathroom, those daily activities of daily living, as it were, to help them, reestablish those activities that they've lost after hospitalization. Because the residents they decondition after they've been sitting in that bed, laying that bed at the hospital for two to 3 weeks. They do get therapy at the hospital, but they really do need extra therapy before they go home. So they come to us for a month, 2 months, and then we rehab them and go home. However, there are some residents who do stay with us long term because they either have declined so much that they no longer back to their previous level of functioning, which means that they want to stay with us long term. And we do have long term and short term beds for those residents. And we do have a locked unit as well. It's not a certified dementia unit. It's not certified, but we do have a unit, actually 2 units where we can have residents with dementia or Alzheimer's.
Okay. And so what kind of staffing do you have to provide those kinds of services?
We have RNs, LPNs, certified nursing assistants on board. And they provide, the care. We do have physicians as well. We have nurse practitioners, we have physician assistants, and we have a medical director. We also have a big therapy department with occupational therapists, physical therapists, and speech therapists, and assistants as well, who provide the rehab.
Okay. And how do you monitor the care of each of the residents?
Well, we have unit managers with each nursing unit who monitor the care on a daily basis. Plus, we have a director of nursing who oversees the nursing department. And every morning we have morning report where the department heads meet. We discuss not only the care of the residents, but the overall well-being of the building, whether it's maintenance, housekeeping, admissions. We discuss incoming and incoming admissions and discharges. We have a social services department as well, and they are big advocates for the residents, beyond all of us who advocate for the residents. And it's a really, really full interdisciplinary team who takes care
Okay.
of the residents.
And how do the families participate? How do you get feedback from them?
Well, we have a grievance process. So if there's a concern, they will come knock on our doors. They'll go to the nurse on the floor first if they have a concern. Then if it's a concern that needs to be escalated to the social services and or the director of nursing and or myself, we all get together as a team because typically if they have a concern, it's not just nursing. It usually could be a number of things. It could be the food that they're concerned about because as you know, food is big for everyone. So we have a great dining services department. So whatever the concern is, we get together as a team and we try to resolve it as a team.
Okay. And how about, I think most people are not aware of the many regulatory bodies that oversee what you do. Can you tell our audience a little bit about that?
Absolutely. So above all, we have the Department of Health, which gives us our permit, our license to be able to operate. So they do have annual surveys. I don't know if your audience is familiar with annual service, which is an audit that they do between 9 and 15 months every year. So they get to look at how we have been providing the care for the last, 12 to 15 months. And we just actually had our audit this year, which went pretty well. And it's usually a team of 6 or 7 auditors, or we call them surveyors in this industry. They come in and they usually have a sample. They ask us for documents, care plans. It could be anything. They're allowed to look at the entire building, whether it's maintenance, housekeeping, nursing, but the primary focus is usually on the nursing care. But they do look at the general environment of the nursing home.
Okay.
And then we also have the ombudsman, whose office is a strong advocate for the residents. So when we have a big concern with the resident, we reach out to them as well for help, and they will come and assist us with the resident's concern. They're a great partner, the ombudsman's office. And those are the two primary. We also work with the insurance companies. We work with Mass Health, which provides us with the Medicaid payments. We work with Medicare, and we bill Medicare for services for our Medicare residents. And we have several partners, other insurance as well. We have, several commercial insurances, which are our partners as well.
Okay. And to humanize this story, can you give us maybe some example of a positive outcome of a short-term care resident or patient who came in and was able to leave? Can you sort of add some humanity to that equation?
Absolutely. We have a lot of great examples. For instance, we have residents who've come back time and time again to the Hellenic because the care was that excellent. So we have one particular resident who's been here 3 or 4 times because when she goes back to the hospital, she will only come here. And not just her, we have several residents who um, over the years have different therapy needs, whether they had a broken leg and they came, some of them will come with really like a hip fracture or a knee fracture. And then by the time we rehab them, they're walking again. And it's a pleasure to see them come in on a stretcher and leave walking. Nothing brings the team much more pleasure than that, to see that the hard work that we've put into a resident's care has great outcomes.
Okay. And then if you could give us a sense of the resident, right? And I would assume it skews towards older, but there's probably a combination of people who come through your doors.
Well, we do take a wide range of residents in age and conditions. Some of our younger residents, could come to us after they had a stroke, and they could be in their late 40s, early 50s. We have a few residents in that category. It's a broad range of residents and needs and diagnoses who come to us for care. And they all, depending on their level of functioning, they participate in activities. They're a very, very active member of our community. So it's a broad spectrum of residents.
Okay. And then how do you connect with the community in terms of activities and working with both local businesses, local government, local citizens?
So I alluded to our partners in the community. We have a lot of great partners. We have assisted living facilities that we partner with. We have other SNFs that we partner with, and we participate in events like yours that we had back in May.
Right.
So we get to network. I go to conferences, for example, with the Healthcare Association, and I get to network that way and share the story of our facility. And obviously, the hospitals are our number one partners because they do refer the patients to us. We have great partnerships with several hospitals in the area: Good Samaritan, BI Milton, BI Boston. Of course, as you know, we've lost a few. We've lost Norwood Hospital. Brockton Hospital just reopened, and we're trying to reestablish that relationship. We do have, and we have, I don't want to forget, we have home health partners. And also we have hospice partners as well. They refer patients to us when they want to place respite patients. That's a big area for us. Last summer, we did have a lot of respite care patients. They just come to us for 5 days, 7 days, 10 days, while their loved ones are on vacation. And we do have respite care also during the holidays. If, the children want to take a break from the care of their loved ones, if they're going away, we take care of those residents for a short period of time, if they so choose. And then sometimes they'll end up staying with us long term.
Okay.
That's another great service we provide.
Great. Well, I think you've given me a pretty good background, and hopefully you've illuminated our listeners as well. What's the best way to reach out to you to learn more?
You can reach me at the Hellenic Home Nursing and Rehabilitation Center.org.
Okay. Well, thank you for being on. I really appreciate it. Any final shout out before we go?
I just want to tell the audience, if they have a loved one for whom they need care, they need short-term or long-term rehab, come see us. We conduct tours daily, and they can just walk in. We have a big sign outside that says we conduct daily tours. They're welcome to come in, and we'll give them a tour of the facility. We're very clean, and we have a very friendly staff as well.
All right. Well, thanks for being with us today.
Thank you for having me.